Welcome to Medical Montana. We are at Advanced Rehab chatting with Sandra Marston. Sandra, your education, tell me a little bit about it, because you have more education than the average physical therapist.
Yes, I am addicted to learning, so it's a personal passion, and I'm completing an entire degree beyond the average in the country. It's called a postdoc degree. I'm working on publishing my dissertation now, and I just completed an orthopedic manual therapy fellowship program, which is several years beyond the average in the country as well. And my colleague, Susanna Clark, has a 2-year residency beyond the average in the country. And so, you know, part of that is personal driven. You know, I mean, it's who we are. You know, we're driven to know, you know, the best ways to help our people. And it translates to you coming in the sense that, you know, we're passionate about getting you better. The quickest way, the most efficient way, and the most complete way. Not just giving you the thing that's the quick fix. And it's not that we're not capable of that. We certainly can do that if that's what you want. But it makes us feel better knowing when we get you better for real, that you're not going to need us forever, that we see you out living vibrantly, and that's what brings us joy.
So how does that translate to the patient, what they pay? Does that mean that it's more expensive to come visit Advanced Rehab?
That's the beautiful thing to the patient, is that you get all of this expertise at no extra cost. As a provider for your insurance companies, we all agree, all physical therapy clinics agree to the same pay rate. So you're not paying more. We're committed to getting you better through that education, and it doesn't cost you anything more.
Tell me a little bit about some of those services that you offer because of that continued education.
Right, orthopedic manual therapy means that we can assess each joint. Is it moving? Is it moving enough? Is it moving too much? Is it stable, unstable? Is there enough muscle support around each joint? And that's each joint meaning each area of your back, you know, and your hips and your shoulders for sure. And then treating it. If it's not moving, we know how to get it moving. And then we know how to train it to support it. Because there's usually, and physical therapy works because there's no magic bullet. You are a combination of muscles, joints, and nerves, and all that stuff. We figure it out, and then we figure out what do we need to do to help you.
Okay, great. Well, thank you, Sandra.
Thank you.